and thanks for the invitation to share with you today a perspective from Spain on health and social care coordination and digital innovation. First of all, a little bit of background from a Spanish perspective. I'm sure you'll see echoes here of many of the challenges which you have in the UK. That is that health and social care have grown organically and they're quite fragmented. There's not a great deal of coordination between the two services. Tradition to focus on acute rather than and reactive rather than prevention. And increasingly, on behalf of the health authorities, an interest in how to address the challenges of people with chronic diseases, typically those aged over 65 and living at home. So when we talk about telehealthcare, I like to be a little bit more precise in the definition which we apply, and I've broken that down into 6 key components. Basic telecare. So this is the scenario where we have a person, an elderly person living at home with a box and button. If they have a problem, they press the button and they receive a response from the call center. Basic telecare. When we talk about extended telecare, this is the scenario where we've integrated the electronic circuits from the button, which we activate manually, into sensors which are placed around the home. So gas detectors, smoke detectors, fall detectors, for example. And then we talk about proactive telecare. This is a concept which we're less familiar with in the UK. And what we mean by that is instead of waiting in the call center to receive an emergency call from the end user, we actually, in the Spanish example, we actually ring out to the people on a weekly basis and we ask them how they are. And this concept has been extended over the years such that when the proactive calls are made, they're actually themed. So, for example, going into winter, people will be reminded to take their flu vaccine. Environmental factors are considered. So if there's a heat wave or a cold spell, elderly people are given reminders about what measures they should take. Now that starts getting interesting because call centers then get bigger because of the much more conversational traffic, and because the call centers are bigger, there are bigger teams, and that in turn gives rise to a stratification and a specialization of resources within the team, and I'll explain more about that later. Then component 5, this is more common in the UK, biometric sign monitoring. So that's where we're measuring blood pressure, temperature, weight, for example, for people at home. And component 6 is what we're really going to focus on today, is the digitization now of many of the components which we've just looked at. So where are we in terms of the evolutionary scale of where these technologies are being used at the moment? So we said components 1 and 2, that's basic telecare, the box and button, and then advanced telecare, which are the peripherals. This is quite a consolidated and established service here in the UK. Number 5 was the biometric life signs monitoring. There are lots of examples of projects here in the UK, but it's not really considered to be a mainstream service at the moment. Spain is actually a slightly different picture. Of course, we've got the basic telecare, that's well established. The Spanish, in fact, have rather missed out on the second stage. They haven't gone in for the deployment of peripherals. What we have to bear in mind is that the Latin culture is more communicative than our rather cold Anglo-Saxon world. So they've gone in much more for the idea of making outbound calls and asking people how they are. That in turn has given rise to a much more complex telecommunications and IT infrastructure, and we'll see the significance of that later on. So from a Spanish perspective, they've got a little bit of peripherals deployment, and they've done a little bit of biometric life sign monitoring, but nothing extensive. And what we're really going to focus on today is this question of digitization and the next step on in the evolutionary chain. So when we talk about digitization, remember this example we were giving of making outbound calls and we ask people how they are. Traditionally, the service stops there. So it'll ring people up on a weekly basis and say, how you're doing. And that's great if you're suffering from depression, anxiety, loneliness. That's a very high value service. But to date, we haven't actually done anything more with that information which we're getting from the end user. The next step in the Spanish model is to actually ask specific questions and then apply digital values to the answers that we get, and to put that information into the IT infrastructure and start using artificial intelligence and analytics, combine the answers which we're getting from these individuals with other data, health data, social care data, and start drawing conclusions from what their state of health is today, and more importantly, to make predictions as to which people are in a higher risk group compared to others. So the questions we ask can be defined in accordance to the conditions, the health profile of the individual in question. So if somebody's got cardiovascular problems, if somebody else has got diabetes, then we have specific questionnaires which we will use in order to draw out from that individual where the higher risk factors could be. So you can see now there's quite a big step towards digitization and converting information about people's state of mind and putting that information into numerical values and including it now into an analytical system. And you know, the question is, well, that sounds all very good and very well, but what does it actually mean in terms of service delivery? And I want to step out of the digital world for a moment and come into the world of biology, really, and this example of the famous caterpillar turning into a butterfly, because I think that the process which we're actually going through in this transition from analog to digital is comparable in many ways to what's actually happening in this example, when we see the caterpillar actually forming its cocoon, and its body decomposes into individual single cells. Its mandibles, its legs, the thorns, the skin, they all decompose into a soup, and then they are reassembled into this completely different creature. And in fact, this is exactly what's happening in the world of analog to digital transition. What happens is when we move into the world of digital, because we've now applied numerical values both to people's current lifestyle, the pressures and the support which they have in their current way of living, we combine that information with other information which could be from smart sensors, well-being devices, social care data, environmental factors, and we then apply an analysis to that in order to make a prediction, a stratification, and convert risk factors into given support packages in order to take preventive measures in order to reduce the risk of further deterioration in their health and social care conditions. So the impact for the market is very significant indeed. The health authorities see the digital telecare infrastructure and the communications which take place via the proactive and outbound calling as a very good opportunity for two-way communication. So they're receiving more data about the situation of individuals in their home, and via the communications infrastructure. Remember, if what we want to do is to optimize people's chronic conditions, we're not going to cure chronic diseases. The best we can do is manage that situation optimally. And in order to do that, we need to understand the situation, so people's current life experiences. We need to find out information about how they're feeling. And then, once we have that information, go back to them with specific support packages. And that's what we're actually doing with this new transition from analog to digital. So for my last slide, I want to share with you some thoughts which we've had about the entire process of moving a system which is largely based around analog and now focusing on digital. What we've seen in our experience with implementing analog and digital telecare and telehealth projects is that there are a number of barriers in the market, not least of which is the level of awareness of how to specify the operating parameters both technically and for service provision of digital telehealthcare. So we've been working with the European Union to support the creation of a new framework, a set of guidelines, a standard, which we've called ENSOM. It comes from the Greek word for integration. And what this does is it helps anyone who either needs more information about how to define telehealthcare, or if you're already an expert in this field, it's your opportunity to get involved, since we're in the draft stage, to help define the set of parameters which will be used by public procurement bodies in order to identify which services are going to be delivered in the future and how they will actually be carried out. So thank you very much, everyone.